All right. Well, good morning, everyone. Thank you so much for joining us today for our Native Center for Disabilities webinar. Today, I am so excited to introduce to you the Sonoran Center's new program manager for Native Initiatives, Agnes Attakai. Agnes has a wonderful presentation today, and she'll also be telling you a little bit more about herself as the presentation gets underway. So without further ado, I will hand it over to Agnes.
Thank you very much for that wonderful introduction. So for today's webinar, the title of the webinar is Silent Struggles, Benign Brain Tumors and Disability. So I am Agnes Attakai. And since we are getting DEI credit for this session, just a reminder that this is open just for only the time of the webinar. So starting from now until the end of the webinar, you have the opportunity to log in and be able to sign up and receive 1 hour of DEI credit, and the diversity, equity, and inclusion credit is only for the College of Medicine Tucson staff, faculty, and students. So if you're a community member, you do not need to sign up for this. And I will also post this at the end of the session. And so I am Agnes Attakai. I am Diné Navajo, and I am the new program manager for Native Initiatives at the Sonoran Center for Excellence in Disabilities here in the College of Medicine. And so just a little bit of housekeeping rules for today's webinar. I just want to say that today's session is being recorded, and all recordings and materials will be available after captioning via email. If you'd like to ask a question, please type in your questions in the chat and we will address those at the end of the session. And if you have encountered any technical issues, please send a message in the chat to the Sonoran Center, who will be monitoring the chat. Live captionings are also available today. So to access live captioning, please click on the live transcription button at the bottom of the screen, and that should be available for folks. So if you need that, and please remain muted until the end of the session, and we'll answer some questions. In addition, we would also like to acknowledge that we are on Tohono O'odham and Yaqui lands. And the official University of Arizona's land acknowledgement is, we respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So again, I want to thank you all for joining us today. And as I said, I'm the new program manager. I do have a master's in public administration from the University of Arizona's Ellard College. I also have a public health training certificate for American Indian health professionals from Johns Hopkins Bloomberg School of Public Health. And the reason why we are discussing this webinar was because I was diagnosed with a 2 millimeter benign pituitary tumor, also called a hyperprolactinoma, in 1999. And so this presentation will talk about benign tumors and the challenges that folks face. And when we talk about tumors of the brain, many times we have images of little children that have tumors. We see that on commercials, especially during St. Jude's commercials. And we also think of brain tumors as when people have a metastatic brain tumor and end-of-life issues. And so there are actually at least 1 million people in the United States currently that have benign brain tumors, and many times our struggles are pretty silent because we don't seem to have this outward-facing view as someone who has brain tumors. So let's look at the first section we'll talk about are the causes of benign brain tumors in diverse medically underserved communities. And in this section, we'll talk about a little bit about brain anatomy, which is really important when we're talking about brain tumors, the types of brain tumors, and facts regarding some of the brain tumors out there. So let us look at the anatomy of the brain. So we know that the brain is the master organ and it controls the body. So we can move, see, talk, and feel because of the brain. We can think, show emotions, make judgments. And in this brain, you have an image here of a brain here. And the brain is, of course, encompassed with the skull, which is our head, which is the bony exterior. And after that, there's 3 layers of tissues called meninges. And this helps protect the brain because the brain is a squishy organ and we have the skull that protects the brain. So the outer covering of the tissue is called the dura mater. You see here on the screen, there is a title here with the dura mater, and it closely lines the inside of the skull. The second layer is called the arachnoid matter, and then the third layer is the pia mater, and this is what the tissue that hugs the surface of the brain. And the brain is cushioned and supported by a special fluid called the cerebrospinal fluid, also called CSF. And this CSF fills the space between the second and third matter. And the spaces within the brain are called the ventries, make up the CSF. In addition, there's also arteries and veins that carry blood to and from the brain. And without a fresh supply of blood, the brain tissue quickly dies. So this is very important to know because any kind of growth within the brain really is when it starts in the brain, really impacts the brain because it's such a small, tight space. And each part of the brain has a certain role. So we see here on the screen here with the image, for example, the cerebellum is mostly responsible for coordinating movements. The brain stem on the bottom that attaches to the vertebrae and to your backbone controls many functions of our head and face, including eye movement, face movement. The temporal lobe focuses on speech, behavior, and memory. The front lobe, movement, intelligence, and reasoning. And the parietal lobe is intelligence, reasoning, language, and so forth. So we see that the brain has very important functions. So when we do have a brain tumor in this tight space, it impacts a lot of these functions. So brain tumor is a growth of abnormal tissue in the brain. So our cells, every single part of our body are made of cells, and the cells grow, multiply, and then die off. And for a variety of different reasons, many times the growth is not stopped. And abnormal growth, meaning extra cells continue to grow and cause brain tumors. And so brain tumors can develop in any part of the brain or skull, even the protective lining that we talked about. And also the underside of the brain stem, the sinuses, and the nasal cavity. So, any kind of brain tumor that grows in any parts of the brain will cause some pressure and possible damage. And there are about 120 types of brain tumors. We're not going to go through all of them. We're just going to cover a couple of them. And then it's important to know that all brain cancers are tumors, but not all tumors are cancerous. Meaning that there are brain tumors that are not cancer, that do not turn into cancer, and they're called benign brain tumors. And they're usually classified into 2 categories, the primary brain tumor and the metastatic brain tumor. So we'll talk a little bit about some of these tumors. And basically, so for instance, we can have a tumor that starts in the glioma part of the brain, the spinal cord, and in other structures as well. So again, this is still the same image of a side of the brain and the most common types of primary brain tumors. So some of the typical brain tumors that people know about are meningiomas, which form in the meninges, the protective lining of the brain. And for this type of cancer, this represents about 30% of all brain tumors. And they grow slowly and may exist for years before being detected. And usually it's diagnosed with women more often than men. And about 85% are non-cancerous and slow growing. And again, many times most people don't know that they have this, and only through symptoms and through diagnostic scans such as MRIs and CTs do you know that you have a tumor in your brain. The next is the pituitary tumor, which is the type of tumor that I was diagnosed with in 1999. And it's a type of tumor that grows in the gland tissue. It's the most common type of pituitary tumor. And it's really slow growing, and about 10% of primary brain tumors are diagnosed as adenomas, and they can cause vision and endocrine issues, and are pretty much benign and treatable with medication and surgery. We also have schwannomas, which is a form of acoustic nerve tumors. They're really benign, slow growing, and on the nerve that connects the ear to the brain. So less than 8% of primary brain tumors are acoustic neuromas. They usually develop in about middle adults, grow on the nerve sheath, and many times cause hearing loss. Next, we have the medulloblastoma, which arises from the cerebellum or brain stem. And these are usually malignant pediatric brain tumors, and it commonly strikes children between 5 to 9 and is very rare for people over 30. Next, we have the glioma, which develops in the glial cells that surround the brain, and it is many times can be found in the spinal cord. About 33% of all brain tumors are gliomas. These tumors can grow quickly and can invade and destroy surrounding healthy tissue. So for this type of tumor, there really is no cure. And these are the ones you hear about that many times it's can be life-threatening for folks. So these are just examples of some of the brain tumors, both benign and then those that can be malignant. So what do we know about brain tumors? So we know that there are about 1 million people living with a brain tumor in 2023. So about 35% of a survival rate for patients with a malignant brain tumor, and about 18,000 will pass on from brain tumors. And so most of these statistics come from the National Brain Tumor Society, and brain tumors are usually classified as brain and other central nervous tumors in research studies. Now let's look a little bit at some of the types of brain tumors that we talked about before. So approximately 72% of all brain tumors are benign, meaning that they are not cancerous. And out of that 1 million people, the majority of people will have be diagnosed with a primary brain tumor. And of course, the most common are non-malignant meningiomas. And those are the tumors that grow out of the meninges. However, about 28%, about 28 to 30% of brain tumors are malignant, meaning that they can turn cancerous. And about 50 are glioblastomas, the ones that I talked about earlier. And usually most brain tumors occur in female more often than men. And the median age for diagnosis for a primary brain tumor is about 61 years. And so for those that the 5-year survival rate for patients with primary brain tumors is about 76%. For non-malignant brain tumors, meaning the ones that do not become cancer, the 5-year survival rate is about 91%. So for example, meningiomas that we talked about, the tumors in the lining of the brain, the 5-year survival rate is 88% after diagnosis. Now for malignant brain tumors, the ones that are cancerous, the 5-year survival rate following diagnosis is 35%. And the glioblastomas that we talked about, the survival rate is only 6.9%. And usually it's only with it's only for about, people survive only for about 8 months after diagnosis. So these are just some of the statistics regarding primary brain tumors. Now, in terms of race and ethnicity, people who are Black have slightly higher incidence rates of primary brain tumors compared to other races, followed by those who are white, Asian Pacific Islanders, and American Indian and Alaskan Natives. So for the incidence rates, meaning the new cases of brain tumors, of non-malignant brain tumors, are highest with people who are Black, followed by people who are white, Asian Pacific Islander, and Alaskan Natives. And usually it's meningiomas and primary tumors. However, looking at the research data on primary brain tumors for American Indian Alaska Natives who are non-Hispanic, there is a poor overall survival and many times lifelong disabilities for folks who have primary non-malignant brain tumors. And I'll talk a little bit about that when I tell you about my personal story. Now, in terms of the new cases or the incidence rates of malignant brain tumors are highest in people who are white, followed by people who are Black, American Indian Alaska Native, and Asian Pacific Islander. And glioblastoma is one of those cancers that are malignant, that is more common among folks. So we've talked a lot about brain tumors, and I know it's a lot of information, a lot of statistics, but I wanted to give you the basics of the anatomy, some of the functions, some of the parts of the brains, and some of the rates. One of the things I like to do is, after 20 minutes of the presentation, is to do a little short wellness break. And this is really important for folks. Wellness breaks are really good in that they give you time to take a pause and absorb information. One type of activity I'd like to share with you is called box breathing. And box breathing is useful for those who are maybe are triggered, who are is part of therapy for traumatic trauma-informed care. And this is also a technique that's used by the Navy SEALs. And so box breathing is, think of a box, and you have 4 steps in this, and each of the steps takes about 4 seconds. So first you would take a breathe in through the nose for 4 seconds. 1, 2, 3, 4. And you keep your lungs full for a count of 4. 1, 2, 3, 4. And then you breathe out through your mouth through a count of 4. 1, 2, 3, 4. And then you just rest and keep your lungs empty for 4. And so you do this until you feel comfortable and feel relaxed. And this type of box breathing really helps to reduce stress. It regulates the nervous system, which is really important for those of us who have brain tumors. It eases panic and worry. It lowers your blood pressure, reduces tension, and reduces headaches, which is very important for me, and improves focus. So this is something you can do while we transition to the next portion of our slides. Hopefully this helps. So the next section, we're going to talk about some of the cognitive and physical challenges of individuals with primary brain tumors. So we're going to talk about brain tumor symptoms and abilities, treatment, follow-up care, and then a little bit about my journey. So as I said, I was diagnosed in 1999 with a pituitary gland tumor. So the pituitary tumor is this really small gland attached to the base of the brain. It's the master gland because it controls a lot of the hormones that are important for the body. And you see here in this picture where the tumor, the pituitary gland is located and how it impacts the hormones, how it releases hormones that impact a lot of functions for muscle, kidney, breast, thyroid, ovaries, testes, skin, bones, and adrenal glands. And so you think of this master gland as a thermostat. So when we have a thermostat in the house, The thermostat constantly measures the temperature in the house and sends signals to the heater to turn off or on to maintain a steady, comfortable temperature. So the pituitary gland is the same way. It sends out hormones to maintain, a balance in your body. So for the most common type of tumor in a pituitary gland is a prolactinoma. So a prolactinoma is when there is a tumor on the gland and it helps to produce more prolactin than is necessary for the body. And so there's an overproduction of prolactin. And prolactin is really important hormone that controls sexual function and pregnancy. So too much prolactin reduces the production of the hormones estrogen and testosterone, and also can prevent the release of eggs during the menstrual cycle. So if you have too much of this hormone, it means your thermostat is not working well. So you're either too hot or too cold, and things are just uncomfortable. So these elevated prolactin levels really suppress some of the sex hormones called gonadotropins, which can lead to amenorrhea, which is the scientific name for not having a menstrual cycle. It can cause infertility, and galactorrhea, which is the scientific name for leaking of breast milk through your breasts, even though you're not pregnant, and reduced bone density. So it means you have a higher chance of getting osteoporosis when you are older. So as a health educator, I always like to provide examples of where the pituitary tumor of anatomy. So here you have a slice of a head, image with a slice of a head, and then the image of a pituitary and where it's located. So it's located right behind the eyes. And it's usually about the size of a pea, a green pea. And in my case, with the pituitary tumor, which I said was 2 millimeters, think of 2 millimeters as the size of the tip of a new crayon point. And see here in the image, there's an image of a pencil, an orange crayon, and an eraser. So 2 millimeters is the size of a new crayon point. It's also the size of a chia seed. So I had a little chia seed tumor on the size on my pituitary gland. Now, as I said before, wherever a brain tumor is located, depending upon your brain, it can impact the functions of that particular part of the brain. So in this image, we have an image of a brain that has different colors that signify different parts of the brain. We talked about the frontal lobe, focuses on personality, the parietal lobe, which sense of pain, temporal lobe, memory, speech, the medulla. So when we have a brain tumor that's impacting parts of the brain, we can have different symptoms. And the symptoms can range from headaches to seizures, to difficulty thinking or speaking or finding words. Many times we'll have personality and behavior changes, weakness or paralysis in one side of the body, loss of balance, dizziness, unsteadiness, hearing loss, vision changes, confusion, and memory loss. So these are a lot of different symptoms. And many times if we are not as cognizant of how our body works, many times these can be symptoms where we're thinking, may not think of us as a concern. But if you have many of these, many times it can impact your quality of life. Now let's talk a little bit of my clinical journey here. So this here is an image of an algorithm. It is basically a map that doctors follow when they have someone who comes with symptoms and what possible things that they might face. So in this case, this is an algorithm for a person who has hyperprolactinemia, meaning that there's too much prolactin in their body. And so I came in with symptoms of amenorrhea, meaning I didn't have menses. My cycle was out of whack. I would go months without having a menstrual cycle. I was infertile. I had been married for about 5 years, and we had been trying to have a child, and it was not working out. So I was visiting my OBGYN regularly. We were doing everything from basal temperature, checking my temperature, making sure when an egg would be released. And it was not until I had galactorrhea, meaning that I started leaking milk out of my breast, that I got really concerned. And I sought out a second opinion from an OBGYN who specialized in female cancers and tumors. And so I went to her and explained my situation, that I was not, we're trying to have a child. My menses was not regulated, and I had liquid coming out of my breast. And so I was fortunate enough when I went to this doctor that she knew what I was talking about, and she had suspicion that it was a tumor on the pituitary gland, because she had many other patients who had the same thing. She goes, well, let's start off with a blood test and we'll look and see at your prolactin levels. And when I did the blood work and the results came in, my prolactin levels were at 400. And so for women, non-pregnant women, the prolactin levels should be less than 25. And for pregnant women, it was 80 to 400. So essentially my body was acting like it was pregnant. And that was why I was not able to conceive. And so going through the second stage, they had to see if it was a tumor on my pituitary gland. So I went for an MRI. So an MRI is a scan that they do to check, uses magnetic fields and radio frequency waves to give a detailed view of the soft tissues of the brain. So I had a contrasting dye that was injected into my bloodstream so they could see the blood flow going into my pituitary. And then that's when they saw that there was a 2 millimeter tumor on my pituitary gland. And they listed it as a microprolactinoma because it was less than 10 millimeters. And so first line of treatment is drug therapy using a dopamine agonist. And in this case, this was in 1999, so it was bromocriptine, also called Parlodel. And the drug was used to decrease the prolactin, the hormones in my body. And so I was on that medication for about a year. So the challenges with drug therapy is that many times they do not know how much to give to a person. So what they'll do is they will give the maximum amount, and then they will start doing blood draws to look at how much levels are in your system. And after a couple months, they figure out what would be the optimal amount for you to take this medication and to reduce the side effects. And for me, unfortunately, the side effects were really severe. I was nauseous. After being on the medication for about a month, I had very low blood pressure. I was getting dizzy. And so then they changed my dosage to half the amount, and I was stable at that half amount. And so I was on that medication for about a year, and this was the time when I was a graduate student. And so I was trying to balance academics, married life, and treating the tumor. And as I was going along, I realized even being on that medication, I started getting constipation and indigestion. So my primary care doctor decided, let's go look at what's wrong. And so I started doing a lot of internal scans to figure out what the challenge was. But I'm the type of person that really looks at and researches things. And so I really started visiting blogs. I started joining the Pituitary Tumor Network. I started talking to people who had similar brain tumors and pituitary tumors, and start researching the data on databases. And I found out that, being on the medication of bromocriptine for quite a while, that it does cause constipation and indigestion. It caused some challenges as well, and that the recommendation was to continue to reduce the amount of medication and to continue with MRI scans. And the last MRI scan I had, my tumor had shrunk. And so I talked to my doctor and I said, well, I think it's time for me to get off this medication because it's probably run its course. It's done what it's supposed to do. And the challenge with that was that if I took myself off medication, there was a risk of having a second tumor grow, or the tumor I have continued to grow again. But we took that chance, and I was glad I took that chance because I actually recovered very well, and I did not have the tumor grow again, and the symptoms all subsided. And what happened was actually 6 months later, I started getting symptoms again, and I said, oh my gosh, the tumor's coming back. And I was nauseous. I had all these side effects. But the wonderful thing about it was I actually took a pregnancy test and found out I was pregnant. So instead of having the tumor come back again, I was actually pregnant. And so that was a wonderful thing that came off of this. Now, my journey through brain tumor, I just gave you just a sort of the clinical side of what I went through in terms of getting symptoms, of being diagnosed and having treatments, and really looking at the options I had in terms of managing my disease. And then I became pregnant, but I still have challenges with living with a brain tumor. The reproductive challenges I had, I was infertile and I could not conceive because I had the brain tumor, and it had high levels of prolactin, meaning it made my body look like it was pregnant. I gained on about 50 pounds. But once I went through treatment and was able to change that, I became pregnant. But I had to be observed during pregnancy because my tumor was still there, and they were not sure how the prolactin levels would impact me or my child, or whether when it was time to go into labor, whether my hormones would kick in. And unfortunately for me, I had a very difficult labor and delivery because my hormones did not kick in. So the Pitocin didn't kick in to start contractions or to labor effectively. So I actually had to be in the hospital for 24 hours and just given Pitocin, which is the medication that they give to make your uterus contract and deliver a child. And so I actually had a lot of bleeding and a lot of challenges with delivery. But my child is healthy, and she's now 22 years old. Another challenge I've had is in terms of, because of the hormone level challenges I've had, I had the high levels of prolactin, the low levels of testosterone, low levels of estrogen. I started going through early menopause because of that. And because of the challenges in hormone levels, I started developing ovarian tumors. I've actually had to have 2 surgeries to remove ovarian tumors. And then I started developing fibroids on my uterus as well. And it was in my 40s that after much consultation with my doctor, we decided for a hysterectomy because the tumors and the fibroids kept coming back. And so I opted for a hysterectomy. And so those are the medical challenges I've had. But in terms of physical challenges, I also developed a vitamin D deficiency. So now I'm actually on clinical doses of vitamin D. I'm at risk for osteoporosis, so I do take calcium supplements. And my weight has fluctuated. So at the beginning, when I first before I was diagnosed, I was at 150 pounds, and I actually gained on 50 pounds. And so weight is a constant challenge for me. And I do exercise, I do eat as well as I can. So weight will always be a challenge for me. I've already started losing a lot of hair and thinning. So I have cycles of that. Long-term risk for rheumatoid arthritis. And fatigue is also a challenge, but also visual field challenges are also one of the things I face, because as we saw in that one diagram where the pituitary is just right behind the eyes, it impinges on the eye nerves. And so every year I have to do a half a day of visual exams to look at everything to make sure it's not impinging on my eye nerve. And unfortunately, one of the things I've had to face is I've had to face retinal detachment. So I've had 2 retinal detachment surgeries within the last 5 years. So some of the cognitive challenges I faced, because I had the tumor and it was impinging on the pituitary gland, it was in the brain, I started developing brain fog and memory losses and memory challenges. And so I actually now use a lot of devices that help me with memory. So I'm a visual person, so I actually have to have a huge calendar on my wall. I have calendars on my desk. I have reminders on my phone. I have used some of the techniques that folks who are neurodiverse, meaning the folks that have autism or ADHD use. I use little checklists. I use little tools to help me memorize and be able to finish tasks. Another challenge I've had is actually develop vertigo. So heights are a really big challenge for me. So buildings that have windows, like here on the University of Arizona campus, we have our Health Science Innovation Building. If I go to the floor that has those clear windows, it's very challenging for me. Elevators that have windows, and stairs are also a big issue. I've actually fallen down a flight of stairs because I lost my balance. And so I do not use stairs as much. And if I do, I have to be very careful of holding onto the rails and really looking down at the steps in order to manage that. And so, balance issues are a challenge for me. But because I've had all these challenges, I looked at other ways that can help strengthen my body, help strengthen my mind, and help strengthen my ability to manage everyday life. So I started looking into what options there are for people with my diagnosis, and Qigong was a great way for me to use meditation and movement to help strengthen my body and my mind and my balance. I also did yoga for the same reasons. I also do tapping. Tapping is one of those techniques where you tap on certain meridians on their face to help deal with confusion and also with headaches. I've done art therapy. I do a lot of sewing and teaching of art. I've done a lot of dietary changes in focusing on a high fiber diet. I also started using a lot of herbal medical teas and connecting with my culture by having Navajo blessings and prayers done for me throughout my life to help me deal with this. And so those are important ways that people can help manage this. And as we move forward, it's very similar to having follow-up care for folks that have brain tumors and treatments. So one of my team that is on my healthcare team is I see my primary care doctor. I also have seen a neurologist and an endocrinologist. I see my vision specialist every year, and I still follow up with my OBGYN because of the hysterectomy, but I still I see them as well on a regular every year. And I'm following up again with all the techniques I use to ensure that I still have balance, that I still have, can use my vision, focusing on techniques to increase my memory. And many times I do have challenges with speaking at times. I have a tendency to speak really fast or I'm at a loss for words at times. Many times complex tasks I have to chunk down into 20-minute increments or figure out a way to do them. And making some decisions, is really hard for me sometimes. If you've got most folks I have lunch with, I'll say, what do you want to eat? So I usually defer to people because I don't like to make the decision of what to eat for lunch. Now, when I tell you about my personal experience, it's really important for those who are health professionals to think about a team that works to address a person who has a brain tumor. Again, brain tumors, we see little children that have brain tumors. There's a whole team that works with little children. And then we're those who have malignant tumors and end of life. And there's us that have primary brain tumors in the middle. And many times our symptoms, are maybe not as severe. We manage, but we need a whole host of folks that help us to manage because, we do have physical and cognitive challenges. So it's really important for us to work with a team that can coordinate all these services because we do need rehabilitation and physical therapy at times. We need to be referred to specialists and eye specialists. So there needs to be a whole team that works with people, but also we really need a team that helps and respects that complementary and integrative medicine is important for quality of life because we still are challenged with memory loss, with cognitive, emotional, and behavioral challenges sometimes. And it's important for us to utilize services that we feel are effective in helping us because managing a brain tumor, going through treatment and then follow up, you never know when it might again come up. So I, as a 55-year-old lady, going into the aging process, I wonder, what type of things I would have to consider as I age. I think about, the risk for osteoporosis, the risk for arthritis, and those are challenges that I have to face. And so it's really important to have a team that works. And really communicating with a brain tumor patient, you really have to think about, the fact that many times patients may have some difficulties in speaking, comprehension, attention, reasoning. So using principles of health literacy are really important. And health literacy is the ability to access, understand, and communicate and act upon health information. So it's really important for the healthcare team to recognize that and to ensure that communication is used in order to help a patient navigate through this whole process of living with a brain tumor. So again, this is the end of the presentation. So my name is Agnes, and I just gave you a snapshot of what I went through in terms of brain tumor. So we'll open it up for questions and discussions. And I think there are some questions in the chat, but also to remember to apply for DEI credit if you are a member of the College of Medicine Tucson faculty, staff, or student. If you want to get 1 hour of credit for listening to this presentation, please use the link or use your phone to scan the QR code. And I will open it up for questions.
All right, it looks like we have a couple of questions in the chat. Agnes, would you prefer that I read those aloud, or did you want to take a look?
Okay, so yeah, can you read it aloud? Because the QR code, the chat I'm looking at has comments as well. So
Absolutely. Okay, so looks like Kai asked, are there specialists to help with all these things that work with PCP and coordination and coordinate all this care you were talking about?
So that is our challenge. Our healthcare system is set up where we have primary care providers that take care of patients, but we also have specialties that people refer to. So it really depends upon your primary care provider and how well in tune they are to referring you and to getting follow-up information back from your doctor, and whether they are really attuned to sending you out to services such as alternative or integrative services. So my primary care doctor I had for 20 years. And he actually was very familiar with people who have primary brain tumors, especially the tumors that I had, because he practiced primarily on the south side of Tucson. And here in Tucson, Arizona, a lot of folks who lived on the south side were getting diagnosed with brain tumors because they were close to sites that had TCE, was trichloroethylene, which is one of the chemicals that was used in, I believe, airplane fuels. And so it was in the water system. So he was actually managing a high patient load of folks who had brain tumors. So he knew some of the challenges that people face. And so he was also very much a proponent of alternative medicine, acupuncture, qigong. So he advocated very much for me to utilize resources. So it really depends upon your primary care doctor and how well they advocate for you. But if you do not have one who does, you actually have to be the advocate and really look up resources and connect with folks and be part of that decision-making process for you, because you know your body the best. You know when you are not functioning at the best, and you keep track of it, and you need to provide that evidence for the doctor that you're working with. So hopefully that answers your question. Is there another question?
Yes, we have a couple of questions about the slides. I just want to address that we will be sharing out the recording of this wonderful presentation within a few weeks in March, and we'll be sure to include a copy of the slides along with that presentation recording. And then we have several questions from Pavi here in the chat. One that maybe you want to address, Agnes, she's asking what your experience is on vitamin D, and also if your everyday life experience is difficult living with your tumor.
So vitamin D. So one of when I had blood work done, they checked all levels of hormones and all levels of everything. So they found that my vitamin D levels were really low. And at this time, they said that taking over-the-counter vitamin D was not going to be as helpful. So they gave me the super high concentrated prescription strength vitamin D. And so I've been on that for quite a while. And so I personally have had no side effects from the vitamin D. It actually has helped me. I believe my body feels definitely different when I do take the vitamin D. So physically it's helpful. And some of the challenges in terms of everyday activities. So I actually get up really early in the morning, and I have to have time to meditate or pray or have some time to be alone and figure out what I need to do for the day. I'll write down what I need to accomplish during the day, and then I refer back to my list. I usually have a list on my phone. And in addition, I also have little timers on my phone. So after every 20 minutes of being on the computer, I have to take myself off and rest my eyes because I do get eye strain really frequently. And so that's what I do. I also have screen protectors on my monitors, on both my monitors and my laptop, and on my phone. So I take those personal breaks to keep myself healthy. And then many times I just need breaks to rest my brain and my eyes. And so in my previous job, I was in a cubicle, and many times people would see me sitting on the floor and just meditating and just practicing breathing. And after a while, I would explain what I'm doing. They said, okay, just want to make sure you're okay. Or I would just rest my head on my desk and just stretch out and just relax a little bit to help reset myself. And then, of course, I have a standing desk, and many times I'll actually be stretching or doing some exercises at my desk to help myself out. And then I also do little activities for my hands as well to offset any pain, because I am at risk for getting rheumatoid arthritis. And then I try to eat as healthy as much and drink a lot of water. So it does impact my daily life. I try to walk as much as I can. I try to exercise. I try to make sure I'm as healthy as I can, because a healthy body helps to deal with the symptoms, but also to prevent future health challenges, because I'm at high risk for osteoporosis. I'm at high risk for heart disease. I'm at high risk for high cholesterol. So I have to think about all these things. Okay, is there another question?
Thank you, Agnes. Yes, it looks like we have a couple of more, and this is a last call for questions. So please make sure to type any questions that you have into the chat. I just want to call attention to the survey that we have posted in the chat. Please take a moment to complete our quick survey. Your feedback is important to us. We take a look at all of the feedback we receive, and it helps inform the development of future webinars. So we greatly appreciate you taking the time to fill out that survey. Also still on the screen is the link to claim DEI credit. Again, the DEI credit is only for College of Medicine faculty, staff, and students. But the survey that the Sonoran Center just shared in the chat is for everyone in attendance today. So please fill that out. We have a question here from Edgar. Cyst and cancer in the brain, is there a difference?
A cyst or cancer in the brain. So a cyst is pretty much a sac that's fluid filled. So it's just the buildup of fluid. And usually cysts can be addressed by draining a cyst. So what they'll do is they will do surgery to possibly put a hole in the brain and put a little tube in there to make sure it's drained out. So that is totally different than cancer in the brain. So a cyst is just a buildup of fluid, and many times that buildup of fluid can be caused by a head injury or infection, and so that can be treated physically. Now, if it's cancer, cancer is abnormal growth of cells, of the brain cells, and that one is uncontrollable, and it can be very small, or it can get very large to where it's impinging on the brain itself. And you know how the skull, the bony part encompasses your whole brain. So there's really not much room in there. So if that's the case, then they usually have to remove that cancerous tumor out there, and any kind of tissue around it that's impacted. And then in order to ensure that they destroy a lot of the cancer cells, that's where they do treatments such as radiation or chemotherapy, whether it's through IV or through drug therapy, medication, pretty much medication to help kill those cancer cells, to prevent it from continuing to grow. So it's two different things. And so one is not the same thing as the other. So hopefully that answered your question.
And Agnes, someone is wondering if we could share a list of all the visual aids and apps that you use. Would it be possible for us to compile that, Agnes, and maybe we could share it out when we share out the recording?
Yes. And then if you have additional questions, I know we're getting close to time. Here is my contact information, my email. So if you have additional questions, or if you like to ask questions that you don't want to ask in this public sphere, my email is here. So I'm more than happy to talk over and to address some of your questions or provide resources. I will compile a list of some of the resources I've used and the tools I use to help me manage every day. And again, this would be a resource that's I have utilized, and so it may not be something useful for you, but it may be useful for you to try out. So hopefully that will help you.
Thank you so much, Agnes, and thank you everyone for attending today.